Hello there, and welcome to the Hepatology Educators Network, a source for information on liver disease management. In today's episode, we'll be gaining insights on the current standard of care for chronic hepatitis B from Sharona Bao, a nurse practitioner who has 16 years of experience in hepatology. Currently, there is no cure for chronic hepatitis B. A common misconception is that achieving undetectable serum HBV DNA and normal ALT levels with current therapies is sufficient for managing chronic hepatitis B. However, the hepatitis B surface antigen remains detectable for most patients. Therefore, there's in fact an opportunity to improve outcomes for patients living with chronic hepatitis B. Let's hear from nurse practitioner Sharona Bao with her insights.
Treatment with antivirals reduces the risk of cirrhosis and hepatocellular carcinoma, but does not eliminate it. A retrospective cohort study of over 20,000 patients in Hong Kong who received at least 6 months of nucleoside or nucleotide therapy, also known as NA therapy, compared the rates of liver cancer over a period of up to 8 years from the start of treatment, and showed that those who had achieved hepatitis B surface antigen loss had the lowest risk of hepatocellular carcinoma compared with those who achieved complete viral suppression alone.
Thank you for sharing those insights, Sharona. Could you tell us more about the impact of chronic hepatitis B on patient quality of life and the challenges associated with disease management?
Yes, patients may worry about residual disease progression or passing on the disease to loved ones and may face social stigma and discrimination. Current standard of care for chronic hepatitis B include NA's therapy or pegylated interferon. NA therapy controls viremia and has a well-established safety profile, but requires long-term treatment and achieve low rates of hepatitis B surface antigen loss. Pegylated interferon has a finite duration and is associated with greater hepatitis B surface antigen loss rates compared with NA therapy. However, its use is limited by contraindications and side effects. To summarize, while current therapies lower the risk of disease progression, such as cirrhosis and hepatocellular carcinoma, they do not eliminate the risk. Hepatitis B surface antigen loss is rarely achieved by current therapies. While patients living with chronic hepatitis B may experience stigma and concern over disease progression, hepatitis B surface antigen loss further reduces the risk of hepatocellular carcinoma and improves survival.
Thank you for those insights, Sharona. And thank you for watching this episode of the Hepatology Educators Network on how achieving hepatitis B surface antigen loss may provide benefits over virologic suppression alone.